The primary health care is defined as essential health care. It means everybody should get. It is needed. It is essential for everyone. And it should be based on practical, scientifically sound and socially acceptable methods and technology. Okay? It should be based on scientific methods, but they should be practical. Means they should be usable for all. Okay? And they should be acceptable also by the all societies. Okay, so these will be primary health care, and they should be made universally accessible to all individuals. Okay, it should be like this, that everyone have the accessibility. Okay, that's why in some countries like India we have started the sub-center to provide primary health care, so that every citizen of this country should get at least primary health care. Okay, and in the community, through their full participation, one more point is given, that the population or the community should have participation in those health services. Okay, how they will participate? It is we who can get the participation from the community. Okay, we can ask them during the planning phase, we can involve them during the health education phase. Okay, and through this we can take the participation from the country. Okay, from the communities. And one more thing, that it should not be so costly. Okay, it should be at a cost that the community and country can afford it and maintain it at every stage of their development. So it should not be so costly. That's why we are not making the huge building for the sub-center. We are keeping minimum staff and minimum technology or techniques or facilities, so that we can maintain it. Okay. Otherwise, if we are keeping more staff, more sophisticated service, then we can not maintain it. Okay. Then finally, there should be the spirit of self-reliance and self-determination.